Asked questions, FAQs 1. I would like to take the college's exams. What format do they take? The college currently awards a fellowship in ophthalmology by examination, FRCOphth. The current fellowship examination structure was introduced in 2006. In order to obtain FRCOphth, candidates must pass the Part 1 FRCOphth Refraction Certificate, the Part 2 FRCOphth Written and the Part 2 FRCOphth Oral examinations. The Diploma in Ophthalmology (RCOphth) examination ceased in 2015. RCOphth was awarded to candidates who have passed both the Diploma, RCOphth, and Refraction Certificate examinations. The Diploma in Ophthalmology (RCOphth) was awarded to candidates who have passed the Diploma examination. 2. I am a doctor practicing overseas. Can I sit the college's examinations or do I need to have completed a period of training in the UK? Eligibility to sit the college's examinations is not restricted to UK trainees. There is no minimum ophthalmic training requirement to sit the college exams. However, candidates are unlikely to pass the refraction certificate without extensive practice and experience of refracting patients. It is also recommended that candidates have completed a minimum of 4 years of ophthalmology training before sitting the Part 2 FRCOphth Written and Oral examinations. Success in these exams will not allow you automatically to apply for places in UK ophthalmic specialist training posts. 3. Would you be able to advise me on the format of the Part 1 FRCOphth Refraction Certificate and Part 2 FRCOphth exams? The Part 1 FRCOphth examination assesses understanding of patient investigations and knowledge of basic and clinical sciences relevant to ophthalmology. This is examined by a 3-hour multiple-choice question paper, MCQ, 1 best correct answer from 4 of 120 questions, and a 2-hour constructed response question, CRQ paper of 12 questions. The refraction certificate consists of a 10-station objective structured clinical examination, OSCE. The Part 2 FRCOphth written examination consists of 1 assessment format, written paper of 180, single best answer, multiple choice questions taken electronically. The Part 2 FRCOphth oral examination consists of 2 assessment formats, structured Viva and objective structured clinical examinations, OSCE. The Part 2 FRCOphth written and oral examinations are synoptic examinations that cover all areas of RCOphth Ophthalmic Specialist Training, OST curriculum. Those areas of the curriculum where workplace-based assessment has been used as continuous assessment throughout training are less likely to feature in the written parts of the examination but may be assessed in the structured Viva and objective structured clinical examinations, OSCE. 4. I am a new trainee and just about to start Year 1 of Specialty Training, ST1. Do I need to pass my examinations by a certain point in training? Part 1 FRCOphth. No previous experience in ophthalmology will be necessary for candidates to sit the Part 1 FRCOphth, but trainees will be required to pass this examination before they enter into the 3rd year of ophthalmic specialist training. Refraction Certificate. No previous experience in ophthalmology will be necessary for candidates to sit the Refraction Certificate, but candidates are unlikely to pass this assessment if they have not undertaken a large number of clinical refractions in the clinical settings of either the hospital workplace or in optometric establishments. Trainees in OST will be required to pass this examination before they enter into the 4th year of ophthalmic specialist training. Part 2 FRCOphth written component. This examination is open to candidates who have passed the Part 1 FRCOphth and the Refraction Certificate and is an exit-level assessment. There is no specific training requirement, but candidates are unlikely to successfully complete this examination without a significant period of training in ophthalmology. It is therefore taken towards the end of training, and trainees are required to pass this examination by the end of Year 7 of ophthalmic specialist training. If these deadlines are not met, then it will not be possible to progress with training and the individual will, almost certainly, leave the training program. Part 2 FRCOphth Oral component. This examination is open to candidates who have passed the Part 2 FRCOphth written examination after August 2014 and is an exit level assessment. There is no specific training requirement, but candidates are unlikely to successfully complete this examination without a significant period of training in ophthalmology. For candidates in OSCE, success in this examination reflects an ophthalmologist who is suitable for recommendation for a CCT when taken with other evidence, such as completion of training, G ARCP6. It is therefore taken towards the end of training, and trainees are required to pass this examination by the end of Year 7 of Ophthalmic Specialist Training. If these deadlines are not met, then it will not be possible to progress with training and the individual will, almost certainly, leave the training program. The Part 2 FRCOphth must be passed before the General Medical Council will award a CCT. In order to be considered for a CCT, the exam must be passed while still in a training post, and candidates should not leave training or give up a training number before passing the exam. If the exam is passed when not in a recognized training post, the candidate must apply for a certificate of equivalence for the Specialist Register, CESR, under Article 14. 5. What happens if I do not pass an exam within the specified time of my training program, e.g. Part 1 FRCOphth, by the end of Year 2? If a trainee does not pass an examination within the required time frame, it will be a matter for the local deanery and ARCP panel to determine whether it is appropriate to offer the trainee additional training time, and a further resit, before progression through specialty training can proceed. In some cases, this may unfortunately mean the trainee being cancelled out of the specialty. 6. Is there a limit of the number of times I can sit each exam? From the 1st of August 2013, candidates are permitted a maximum of 6 attempts to pass the Part 1 FRCOphth examination and a maximum of 6 attempts to pass the Refraction Certificate examination. Examination attempts prior to August 2013 are discounted. From August 2014, candidates are permitted a maximum of 4 attempts to pass the Part 2 FRCOphth written examination and 4 attempts to pass the Part 2 FRCOphth oral examination. From August 2014, candidates are permitted 4 attempts each for the Part 2 FRCOphth written and oral components. 7. If I pass college examinations outside a training post, can these then be counted towards the requirements for my CCT? Regarding the GMC statement on taking exams whilst in a training post, does this include being on an OOPE? An examination can be taken before the candidate enters the relevant GMC-approved training program or when they are on a break in the program. The pass will be considered current as long as the candidate enters or re-enters the program within 7 years of passing the examination and satisfies any other currency requirements. A pass in an examination taken after completing a run-through or higher training program will not be acceptable for a certificate of completion of training. In that situation, doctors may be able to demonstrate equivalence via the CESR or CEGPR process. With regard to being on an OOPE, a training post is considered to be a post that has been approved by the GMC for training. In order for this post to be valid for your training, then you must have approval from the college and deanery to undertake this as part of your training. Some OOPEs may not fulfill these criteria, e.g. post-CCT fellowships, research OOPEs, educational OOPEs, and it is important that you ensure that you have confirmed that when you apply for a post that you confirm that it is a valid training post recognized for your training. This also applies to those who are in a LAT post. Applications for training approval must be prospective. 8. Does success in the exams exempt me from any work-based assessments? No. The assessment system for those in OST is mapped to the curriculum, and this consists of both WP-BAS and examinations which complement each other. 9. When should I take Part 1 FRCOphth? Will completion of the Part 1 FRCOphth be required in order to enter specialty training in ophthalmology? I do not know whether to consider sitting the examination near the end of my F2 year or to wait until after completion of the foundation program. The Part 1 FRCOphth can be taken at any time following graduation of medical school, but sitting this examination at such an early stage is inadvisable. You will have a large number of generic competencies to get through in your foundation years, and you are advised to concentrate on these skills and wait until you are in OST until you attempt any college exams. 10. I am an ophthalmic specialist trainee. Can I choose to sit the fellowship assessment? Applications for first submission of casebooks for the fellowship assessment have now closed. The fellowship assessment will be withdrawn by the end of October 2015, irrespective of the status of any remaining trainees. 11. Do I have to wait until I have obtained my third Rita C, ARCP5 before I am able to sit the Part 2 FRCOphth written component? No. However, candidates are reminded that the Part 2 FRCOphth is an exit-level assessment, and candidates are unlikely to successfully complete this examination without a significant period of training in ophthalmology. 12. I am in a lap post at the moment. What routes to fellowship, FRCOphth, are open to me? Doctors who do not hold a substantive training post, but have successfully passed the Part 1 FRCOphth and Refraction Certificate remain eligible to sit the Part 2 FRCOphth as a route to obtaining fellowship of the college. 13. I am a specialty doctor wanting to apply for a Certificate of Eligibility for Specialist Registration, CESR, via Article 14. Can I sit the FRCOphth Part 2? And will this help my application? In order to sit the Part 2 FRCOphth written examination, you must have passed Part 1 FRCOphth and the Refraction Certificate. If you fulfill these criteria, then you are allowed to sit the Part 2 FRCOphth written examination from a specialty doctor post. Candidates must pass the Part 2 FRCOphth written examination after August 2014 in order to be eligible to sit the Part 2 FRCOphth Oral examination. Success in Part 2 FRCOphth Oral examination confers the award of Fellowship, FRCOphth. This will provide valuable evidence of competency against the OST curriculum, which will count towards your CESR application. 14. If the Part 1 FRCOphth examines optics and refraction, why is there a requirement to obtain the Refraction Certificate? The Part 1 FRCOphth contains theoretical optics questions. There is no assessment of clinical skills. You will have to pass the Refraction Certificate, in addition to Part 1 FRCOphth, in order to progress to Part 2 FRCOphth. 15. When did the Royal College of Ophthalmologists cease running the old-style FRCOphth examinations and start the new-style FRCOphth examinations? The last Part 1 FRCOphth was sat in October 2006. The last Part 2 FRCOphth was held in November 2008, and the last Part 3 FRCOphth was held in September 2008. The new Part 1 FRCOphth commenced in October 2006. The Refraction Certificate commenced in July 2007, and the first Part 2 FRCOphth was held in October 2008. 16. I have passed the Part 2 FRCOphth. Which examinations can I now take? As of the 31st of August 2017, Part 2 FRCOphth no longer grants eligibility for the Part 2 FRCOphth written examination. 17. Is the FRCOphth equivalent to FRCOphth? And if not, where does the FRCOphth stand? The Part 2 FRCOphth is an exit-level qualification for ophthalmic specialist training, and as such assesses knowledge and competencies at a high level. It is recommended that candidates have completed a minimum of 4 years training in ophthalmology before sitting this examination, whereas candidates for the Part 3 FRCOphth needed to have completed 18 months. These are therefore not equivalent examinations of ophthalmic knowledge. However, the assessment of clinical skills in the both OSCEs assesses the ability of candidates to reliably elicit clinical signs at a competent level. 18. I have FRCOphth but I am not currently employed as I am still trying to get a number after being a LAT. Am I required to complete another examination? FRCOphth is no longer an acceptable qualification for entry to OSCE as of 2016. If you wish to apply for specialty training at ST3 level, you will need to pass the Part 1 FRCOphth. 19. I have passed the International Council of Ophthalmology examinations. Am I exempt from any part of the FRCOphth examinations? The college does not offer exemptions to candidates who hold ECO examinations. 20. I am a Fellow of the Royal College of Physicians and Surgeons of Glasgow. Am I eligible to sit the Part 2 FRCOphth examination? The college does not offer exemptions to candidates who hold FRCS Glasgow. In order to obtain FRCOphth, you must pass all the college's fellowship examinations, Part 1 FRCOphth, the Refraction Certificate and the Part 2 FRCOphth. 21. I possess examinations or qualifications from the Royal College of Surgeons of Edinburgh. Am I eligible to sit college examinations? Candidates possessing any qualification from the RCOphth are no longer eligible for the Part 2 FRCOphth. Any candidates holding RCOphth qualifications will need to pass the Part 1 FRCOphth and Refraction Certificate in order to progress to the Part 2 FRCOphth. 22. What should I bring to the exams? You must bring government-issued photographic identification for verification to all college examinations. For the online proctored delivery of the written exams, you will be required to show your ID via your webcam to the live proctor. Candidates may bring their own clinical equipment to an examination, if desired. However, all items must be contained within a clear plastic pencil case or plastic bag. 23. Can I use my own pen during the written exams? All written examinations are taken on a computer via online proctored delivery. Pens, pencils and scrap paper booklets will not be allowed.